Addictions are survival strategies, you know. Like the 12-step programs refer to the term as character defects, you know, but character defects started as survival strategies. And so people needed them, and that's why they're there. And so one of the things that a huge thing that people are looking at in recovery are like, how do I engage with people in the world and myself? And what's not working about that? Everybody who has one addiction or another probably relates to some aspect of the various themes in sex and love addiction, because really they're all about trying to have relationships without being hurt. That's what those addictions are. They're like really ways of letting in some intimacy or perceived intimacy, but blocking out what might most likely hurt them. It's very difficult for people to understand about themselves or accept about themselves because of the way sex addiction is stigmatized in our society. And it's really very pervasive with addiction. You know, sex addiction, love addiction, all of those, they're all related. When I talk to people in first screening them, even when they come in for help, like that's one of the first things, no matter what their issues are, is like, what's going on with your relationships? Because for most people, that's what really makes life enjoyable. That's what helps people find support when they need it. That's what helps people cope, is having good relationships. And when people have untreated trauma, they often are looking to relationships to resolve something that's inside. We're looking at what's going on in your life that's not working. What have your relationships look like? Why do you keep ending up in the same place of being abandoned or feeling like you're teaching this person how to function and then they've moved on to someone else? But what is the role? Like, are you fallback woman? Are you fallback man? And why? And how is it really serving you? It starts with boundaries, like learning what is a healthy boundary. Like, a lot of people don't even really know the difference between what is a friendship, you know, and what is a romance, and what is a dating period, and what are the boundaries of a teacher-student relationship, and like, what are my boundaries with my child? People sometimes have a lot of shame when they realize how off their boundaries are. So helping them understand, like, how are you supposed to develop boundaries when this is what you were exposed to in your life? So much it's about fear. You know, it's about like people that really weren't prepared for the world and to function in it with relationships for good reasons. So in groups, we get to reparent them and give them a new family setting. And then we help them also to learn that, especially in an IOP or PHP, people are here short term. So almost as soon as you're saying hello to people, you also are gonna be saying goodbye to them. And so what's that like to let some people in? They might be in your life for a very short time. Some of them you might choose to have ongoing relationships. Some of them you might not. Who's a good fit for you? How do you make those choices? And that helps. When we do that in groups, in treatment centers, that becomes a model for what they could do out there in life.